What we've been able to do at Smile House, it's a magnet. When you create an environment for people to thrive, for not only our patients, but for the people that serve those patients, we will have a magnet that attracts the best of the best. And we are on our way to doing this. We have an amazing team of specialists. So the specialists that are orthodontists, which is all about understanding the mechanics of the jaws and the tooth relationship and how to move them in the most effective way to enhance facial aesthetics and function. We have periodontists that do an amazing job at understanding the supporting structure of the tooth. We also place implants, of course, and we really drive the oral health through our periodontal team and our hygienists. And then we have the prosthodontists. I lead our team. The prosthodontists, we are the architects of the smile and the health. We drive the aesthetic, structure, function, and biology, that whole mouth mapping diagnostic with our specialty team. And of course, our technicians, they are amazing. We have our digital technicians that work on what's called the digital workflow. What that means is we now scan. We don't take those impressions with all of those gooky alginates that goes down the throat, but it's just using basically a video camera that takes very accurate representation of the mouth and turning that into a 3D model. So we scan, we design on computers. We design where we're looking at all of the things necessary for aesthetics and also for structure whenever we're making appliances, sleep appliances, night guards, we call them orthotics, or even prosthesis and crowns. And restorative dentistry is all designed on computers today, and then we 3D print and we go through CAD/CAM. So we scan, design, manufacture in this digital workflow. This is very new to dentistry, and we've developed an amazing team of technicians that do this, along with our artistic ceramics to duplicate nature for aesthetics. So when you put this all together, this team of specialists and our technicians and our support team, we have now been able to create this magnet of excellence for our people. We deeply believe in building what's called a learning organization, where our team is constantly teaching, training, learning together. On Friday mornings, we have this collaborative approach. It's like grand rounds for dentistry. We all get on a Zoom call together. We look at our patient data. We diagnose together. We set the treatment plans, the care plans, but it's done through the lens of multiple doctors looking at things. Not one doctor, one assistant, or one hygienist in an office, but we have actually 14 doctors between our two offices uptown and Smile House downtown, where we collaborate, work together, and work on these care plans to really drive the care for our patients in the most appropriate way, which is usually the most conservative way to get to where we want to get to with our patients' health. We use these plans and explain this to our patients visually, because that visual image is very easy to understand what the issues are and then what our suggested solutions are.